Yoder's clinic, where we discussed Mr. Yoder's case today.
Hey Sam, I believe you are managing Mr. Yoder's case. Would you like to get us started on how we can help the patient on his journey to better health?
Thank you, Dr. Trivedi. I'm delighted to discuss Red's case with everyone. Currently, our focus is on facilitating Red's return home following his bout with sepsis. To alleviate the strain on his son, John, we're coordinating various farm-related tasks with assistance from members of the church and the Veterans of Foreign Wars. Recognizing the challenges faced by John, who, alongside his wife, has been the primary caregiver, we've connected him with a caregiver support group to address the overwhelming nature of his responsibilities. Concerns about Red's medication adherence have prompted us to involve nursing in exploring potential reasons behind this issue and collaboratively devising solutions. Simultaneously, we've requested a cognitive deficits evaluation to rule out dementia as part of our comprehensive approach. We've shared information with Red about a long-term care programs for future consideration. Our goal is to ensure a well-rounded support system for Red and his family during this challenging time.
Hello everyone, just wanted to give a quick rundown of everything the nursing staff is doing to help take care of Red. We are really focusing on education of both Red and John while in the hospital. We're emphasizing the importance of antibiotics and how important it is to finish the full course. We're explaining sepsis and the impact it could have on him. We are reinforcing the diabetes education that Ham included in his teaching and measuring Red's competency for checking his glucose levels and self-administering insulin. We are measuring Red's skills and competency for using ambulatory aids and letting case management know of any needs for Red for when he returns home. We are ensuring that we are talking with John and educating about Red's memory loss, listening to his concerns, and we have been working with case management on possible options for him to help care for his dad as he progresses. We are also ensuring that we are listening to John's concerns as well as Red's concerns with the plan of care, and we are offering solutions to help them progress in their care. We're also using the Braden scale to help care for Red and to help with education on incontinence and the importance of wound care. And lastly, we will evaluate Red's progression of memory and help explain the care he has received while in the hospital.
Hi everyone, I'm in charge of Mr. Yoder's psychological needs. I noted a couple of concerning details that might be affecting the way he's perceiving and responding to his current healthcare plan. Currently, he's dealing with significant stressors in managing his chronic diabetes while having a social history of being a veteran during Korean War, loss of his wife, chronic insomnia, daily alcohol use, loss of capacity to make complex decisions, which are prominent risk factors for neurocognitive disorder, depressive disorder, and PTSD. So, Sam, it will be great if you can arrange for Mr. Yoder to come to our facility for a clinical interview, where I'll gather more information about his past experiences with healthcare, experiences as a veteran, reason for living independently, and social equation with son and daughter-in-law. Obtaining this additional information will help me accurately diagnose patient using DSM-5 criteria. Furthermore, I'll caution Mr. Yoder against using Benadryl for his sleep problems as he reports drinking alcohol daily because this combination might be causing him increased drowsiness and dizziness. Instead, I'll counsel him on sleep hygiene and cognitive behavior therapy once per week for maybe like 10 to 20 sessions. Not only is CBT a first-line treatment for insomnia and helps in slowing cognitive impairment, it can be delivered via telemedicine, which I believe is the best course for this patient. Considering the interconnectedness of mental health and family well-being, I'll also reach out to John and his wife to join Mr. Yoder's in a few CBT sessions. And this will help the family to keep up with Mr. Yoder's mental and emotional state and provide an opportunity for enhanced communication in a respective environment. Lastly, I'll follow up with Mr. Yoder's in maybe like 3 months or sooner if needed. I think that in addition to counseling, patient will benefit from diet and lifestyle guidance due to his age. Can we do something to help Mr. Yoder in living independently?
Thank you, Natalie, for bringing that up. We've actually extended support to Red by referring him to Area Agency on Aging programs. These programs include provisions for diabetic diet, home-delivered meals, aid with housekeeping, and support for independent living. To address Red's specific health needs, we've also initiated contact with the diabetes educator.
Hey everyone. So with Mr. Yoda, essentially informing him importance of medication adherence, how to take blood sugar, how to take his insulin. And I'm also trying to emphasize the importance of his diet along with him and his son. Hopefully these lifestyle changes can help him become more conscious of his diet and decrease the sugar, carbs, and increase his vegetables and protein. Along with that, before his injury, he walked a lot, and I'm going to try and bring that in. Aerobic exercise is very important for diabetic control, so I'm going to have him start doing that again, along with eating and overall improve the quality of his life. That's all from me. Dr. Trivedi, anything else you want to add?
No, I think thanks everyone for your support and insight. Working with all of you was a pleasure for the patient care of Fred. I will keep reaching out to you guys regarding the updates on his care. I'll retrieve and keep track of the newly prescribed or recommended changes in patient's medication list and run it through our pharmacist to avoid any drug interaction. I will schedule a follow-up with the patient in a month and at our clinic and get his blood test done to monitor his A1C and infectious etiology. So we involved the transdisciplinary team in the process of creating Mr. Yoder's care plan. In the Paramount Healthcare Providers Clinic, we made sure to focus on the comprehensive care of Red, who has recently been discharged from an inpatient admission for sepsis. Patients like Red with higher healthcare needs often have difficulty navigating through the system, which can be quite complex, especially for patients who face multiple barriers in seeking and obtaining care. So only by virtue of this transdisciplinary team consisting of physician, social worker, nurse, health educator, and psychologist, we were able to provide the required emphasis on education, health literacy, and socioeconomic barriers of our patient, which I'm sure will help in enhancing the health outcomes for this patient. Thank you.